A new study shows at least 17 million people in Europe suffered from long COVID. And when it comes to long COVID, we often think of symptoms like fatigue and brain fog. Joining us now is Dr. Upinder Singh from Stanford Health Care. Doctor, thanks so much for joining us. Do we know more about any of the known cases of long COVID and why some people are more impacted by this than others?
So I think we're at the very early stages of understanding long COVID. We know that there are some very common symptoms, as you said, brain fog, fatigue, some cardiovascular symptoms, but I don't think we really fully understand why some people with long COVID get brain fog and other people get cardiovascular symptoms. And we certainly don't understand why some people never get COVID or people get COVID but don't have a long COVID symptom. So again, there's a lot of hypotheses that are being studied, but we don't have any definitive answers, unfortunately, at this point.
Yeah, it can be so frustrating to hear about all these different cases. Are there any treatments available for those suffering from long COVID?
Yeah, so unfortunately, at this point, there's no directed therapy. There isn't a medication that can treat the cause of long COVID. Right now, I think what most physicians and what most patients are doing are finding things that help the symptoms get better. So, if there's fatigue or other things, sort of finding some medications that help that symptom. But understanding the underlying pathophysiology, why that person got long COVID and those symptoms, and what medication can be used to treat that. Unfortunately, we don't have that right now. A lot of work, a lot of research around the world is being done on this. And I think as we move into the next phase of the pandemic that we're in now, where thankfully, the number of acute cases of COVID are going down. Thankfully, there's vaccinations and other strategies. I think this really has to be sort of the biomedical group's emphasis for the next year or two to identify some therapies.
Yeah, one theory that I've seen sort of been circulating since really COVID started was this idea that folks that often get long COVID are somehow deficient in vitamins or different nutrients that maybe could fight a virus more efficiently. Is any validity to that say maybe somebody taking a vitamin D supplement or taking a multivitamin or changing their diet in some way could anyhow prevent long COVID?
I know there's a lot of interest in that. I think right now there's no evidence to show that anybody who gets long COVID is because of a vitamin deficiency or some aspect of their diet. There are a lot of patients with long COVID who are trying supplementation or changing their diet to a less inflammatory type of diet. I think those things, if done, carefully, are fine. Maybe it'll help the symptoms. And even if it helps 10, 20%, since we have no other therapies right now, I support that. But I don't think we have the data to say that that's the root cause and that that's going to help, the millions of people around the world who have long COVID.
Yeah, it's interesting now. I mean, compare this to 2 years ago, it's hard to find anybody who hasn't had their time with COVID. But if you're one of the very few that has not caught COVID by now, what are the chances are that you're never going to catch it or your body is just going to fight it off before it becomes an illness?
Yeah, so, I think, like you said, there are people who haven't had COVID, and we do really want to understand what makes them different, right? Has it been simply a behavior change, right? That they just haven't left their home and haven't been around people. But it's hard to believe that just with socialization and people coming in and out of their home, that's been possible. There are people, including healthcare workers, who've been exposed to COVID over and over again and have never had symptoms and never tested positive. So I think understanding them, their genetics, their makeup, their immunology is going to be so important. And then they'll be really good controls for us to understand. Sometimes understanding health is as important as understanding sickness. So I think in this case, understanding people who never got COVID or people who got COVID but never developed long COVID symptoms is going to be really important. There still are people who haven't had COVID. They're going to be really in demand in terms of research studies because I think that is a really important area to investigate.
Yeah, and I'm curious about these vaccines too. If you're keeping up to date, you're getting you're getting vaccinated, you're getting your boosters. Would that, you know that keeps you out of the hospital, but does that also prevent you from possibly getting long COVID as well?
Yeah, there's some data actually that being fully vaccinated and boosted decreases your chances of getting long COVID by about 50%. So if you get COVID, your symptoms won't be as severe, and then your likelihood of getting long COVID is about half. That's good, right? Yeah. That's definitely an improvement. And so we do think, continue to think that, prevention is the best thing. And so avoid getting COVID, avoid getting repeat episodes of COVID, be up to date. There's a new variant vaccine out now, get it if you're eligible, which most people will be. Again, these vaccines are incredibly safe. And I do encourage people to continue to be careful in their behavior, right? If they know they've been exposed to somebody, watch your symptoms, get tested, don't expose others. And remember, there are a lot of people in our families and in our communities that are immunosuppressed. Their immune system is low. They can't respond typically to a vaccine. They're still getting sick despite vaccination. They're still getting hospitalized. So we do want to sort of keep that community perspective in mind.
No question. Dr. Upinder Singh from Stanford Health Care, thank you so much for joining us.
My pleasure. Thank you.